Hi, I'm Sue Ricks from SueRicks.com and the online Sue Ricks Academy. And the question is about our course, which is the course of Gentle Touch Reflexology, using these techniques to support people who've been diagnosed with cancer or are in palliative care. So the question very specifically is, as I read from my piece of paper, what are the benefits to the cancer and palliative care patient in receiving this type of reflexology rather than regular foot reflexology? I love this question because I'm a huge fan of reflexology, and whatever you've qualified in and the techniques that you use to train, these are all going to be so valuable in the treatments that you offer to people. And this particular course, where I'm going to be going through using the gentle touch of reflexology techniques to support people who have been diagnosed with cancer or who have other conditions and are in palliative care. Because gentle touch reflexology is so utterly delightful. It's the most gorgeous thing. It's incredibly light and gentle, and even on the videos and the DVDs that I've done, people say when they experience it that it's actually lighter than it looks, and it's utterly delicious to both give and receive. It's just wonderful. It's just glorious. And when I've been teaching, I've told so many people that this is the most marvellous way to work, because it doesn't hurt your hands, it doesn't hurt anybody receiving it, it allows them to get the most incredible benefits. And people think that because it's light and gentle that it doesn't work, and it's absolutely not true. It's the most incredible thing. People experience just wonderful things because there's no pressure, there's no push, there's no hurt, there's no get in there and sort it out. It's a flowing, gorgeous, soothing, beautiful treatment that practitioners, and I've been teaching now for such a long time, that it's just something that I've almost become so used to hearing, and I need to keep reminding myself so that I can tell other people too, that people are so surprised at the effectiveness of the technique. And so if you want to offer a technique to somebody that is utterly delightful to receive, and because when people are having these treatments they are maybe suffering a lot at the time, and so you're able to offer something that's really beautiful to receive, and people just sink back completely, let go, they can actually then connect in with themselves, they can make their decisions, they're more confident, they're more able to relax, they can cope with any pain and discomfort. If they're going through nausea because of chemotherapy, then it's so much easier to manage. I have treated for years and years and years, and I cannot tell you how many people have said, well, so-and-so's experiencing this, but I seem to be okay. We make no promises to anybody at all. But I am used to seeing people in my clinic, and I work with people extensively because number one, I'm a practitioner, and number two, I teach. And that's why I do it, because I see it working day in and day out. Some people who are going through chemotherapy, they have terrible skin problems and their skin hurts. There's no pressure of this technique. It's just fabulous to give and receive. So that's one of the benefits of the gentle touch of reflexology for being able to help people who are going through these challenges. And it doesn't just apply to people who are having oncology care. It also applies to people who've got all kinds of things. So we are talking about people who've got very serious illnesses, and that could be right across the board. So these techniques are just beautiful to give and receive, and incredibly effective too. And when you've experienced them for yourself and used it on your nearest and dearest to try them out, and then you know that you've had the practice to be able to use out in the real world. So this qualification is uber brilliant to be able to help people on all kinds of levels. So I'm Sue Ricks from SueRicks.com. Look forward to connecting you on one of the courses.